I'd like to call our meeting to order today. And I want to start with welcoming our newest citizen committee member, Gabe Napici. So welcome, Gabe. And with that, your staff will take roll call.
Francis Duncanson,
Here.
Don Bonaprise,
Here.
Brad Olson, Tom Garvey,
Here.
Cindy Johnson,
Here.
Bill Oliva,
Here.
Rita McKee,
Here.
Gabe Napici,
Here.
and Dr. Arnie Loggins. Thank you.
Okay, and with that, moving on, I'll look for a motion to approve the agenda.
So move as presented.
I'll second it.
Discussion and a vote. All in favor, say aye.
Aye.
Opposed, nay. Okay, and then moving on to our next item would be approval of the minutes from the June 2024 meeting. I don't know if everyone has had a chance to review those prior to the meeting or not. I think we're out. So when you're ready, I will take a motion to approve our minutes.
Move to approve.
Okay, any discussion? All in favor indicate by saying aye.
Aye.
Opposed? I'll sign there. Public comment. Do we have any members from the public who would like to make comments today? Doesn't appear so. Okay, and with no public comments, we will move on to our next item. Do we have any supervisors here who are not committee members who would like to present any information? Does not appear we have any present who would like to do that. Okay, and with that, we'll move on to agenda item number 7, which is our report from Golden Age Manor. Dana, if you would like to, you're online. If you would like to give that report, we're ready for you.
Can you hear me?
Yes.
Hi there. This is Dana here at Golden Age. Let me see if I can camera. Kind of bright in here, but you can kind of see me. Hello, everybody. I don't have a lot to report this month. Nothing too new over here, which is usually a good thing. We're still offering our CNA classes. So we have a class that just started. We have 3 people in that class. So that's still going really well for us. 2 more classes scheduled this year for September and November. So we got several high schoolers trained in over the summer. So that was great. Now looking at the fall, it's a little harder, of course, to get those students, but we have had luck with some of the local schools letting those kids through like youth apprenticeship come and do their in-person training. Right now we're currently recruiting for some nurses. That's posed to be a little harder for us, especially for those PM and overnight shifts. Some of those of you who have been on the board longer know we've kind of been working on some international recruitment for the past several years. That's kind of at a standstill. We check in every 6 months or so with the people that are helping us with that, but that's just been a struggle with visas and those sorts of things. Otherwise, around the building, we're doing some capital improvements, some kind of, with a building that's, 60 plus years old, just doing some flooring updates, things like that. So that's kind of fun stuff to update. As far as reimbursement goes, we've been fortunate over the last couple of years to have increases in our Medicaid rates, which is about 70% of our population here. And it's kind of a unique time in that some of our Medicaid rates are higher than some of our private pay rates. So we're looking at making some changes to that structure as well here with our next budget, with the new budget cycle. But yeah, that's kind of in a nutshell what's going on over here.
Thank you, Dana.
Yeah.
Does anyone here have any questions for Dana about her report? John?
Is she gonna be able to hear me?
I believe
Yes.
so.
Dana, are you working or do you have anything for me to take in a resolution form to the steering committee and pass it on to the general assembly?
I don't yet, John, but I will keep working on that, trying to get a little bit more information on, what our new rates usually come out mid to late July, so I should know where we sit with that supplemental payment within the next couple weeks, I'm hoping. So I'm gonna know a little bit more about how that's working. With the new system, they're kind of doing it's just so different. So I will keep in touch with you on that, John.
If we can get back to any kind of allocation, we just got cut out, and what they did was they reallocated to, like, we came out pretty good after all the $900,000 loss. But what they did was they reallocated like to over Racine County, and the ones that were losing money, they took money from us and tried to help them out and put us in a damn tough situation.
Yep. Yeah. And luckily with those Medicaid increases, it helped us kind of, keep that even as much as we could. But yeah, it's still a struggle, that's for sure.
Some other units in the same situation that we are, if we could kind of get something together to get them to reallocate back to at least reality.
Right.
So I'll be in touch with you.
Sounds good.
Thank you much, and thanks for everything you do.
Thank you.
Yeah, thank you, John, and thanks, Dana. Do we have any other questions for Dana this morning? No? Okay, thank you for that report.
Thank you.
I have one question.
Oh, okay. Yes. Dana, are you still there with
Yep.
us?
Yep.
Rita has a question.
What is your
Great.
census right now?
We are right at 60. So we kind of fluctuate on either side of 60, we go 58, 62, 65, right around that is kind of our comfortable spot with staffing and how we're currently laid out.
Okay,
Yeah.
thank you.
Yeah.
Okay. Looks like I'm not missing anybody. Thanks again, Dana.
Yep. Thanks.
Our next agenda item, number 8, is our Veteran Service Officer Mid-Year Program Report with Andy. Morning, Andy.
Good morning. So I'm just going to give a brief update regarding some of the key benefit decisions or ratings that we've had come through. So for veterans who have chronic injuries or illnesses that occurred in service, they're able to apply for disability compensation for those conditions. So we've submitted so far this year 123 of those claims. Of those decisions or of those claims, we've had a total of 110 decisions. So what that looks like basically with those ratings or those decisions through the Department of Veteran Affairs, we've had a total of $871,000 paid in retro payments to veterans for those compensation claims. So it's a lot of money. I mean, it's for 110 veterans, 871,000. I don't know what that comes out to, probably somewhere around $10,000 per veteran, but it's a nice retro payment. We've also done the application for 25 property tax credit certificates. So for veterans who are 100% permanent and total service connected, or a surviving spouse of a veteran who died because of a service connected condition, are eligible for the Wisconsin Property Tax Credit Program. So what that looks like is they can get a tax credit or a refund on their taxes for their primary residence and up to 1 acre of land. So for example, if you have a veteran who lives on Balsam Lake and their property is, 1 acre or less, they can get all of their property taxes back through the Department of Revenue if they're eligible for that program. We've also done 29 Wisconsin park passes and then 49 new enrollments into VA healthcare. Had, looking at comparing years past, we've had a busy 6 months so far. So, does anybody have any questions for me?
I have a comment.
Yes,
They're very efficient at their work. I tell you,
yes, they are.
I was one of those 110.
Ah, good. Yeah, it's nice to see people get the things that they're entitled to. And especially, like you were saying, that it's retro and it's something that they should have been getting right along. So, it's great for them to get caught up then and get that payment and get what they're supposed to be getting.
Absolutely. Yeah. So another tool that we can do is it's called an intent to file. So if a veteran comes in with a condition, say if they don't have it clinically diagnosed yet, we can submit what's called an intent to file where it'll preserve the effective date of that claim for up to 12 months. So that gives them time to get a medical, diagnosis, any other evidence that they might need in support of their claim. We submit the claim then, and if it takes the VA, 4 months to make a decision, they're gonna back pay all the way to that intent to file effective date.
Wow.
So to give you an example, we had a veteran, we submitted a claim in 2019 and it went all the way to the Board of Veteran Appeals this year, and they just made a decision on it a few weeks ago. His retro payment alone was $101,000.
Jeez,
Oh.
that wasn't me.
I think it was Jay.
So as long as you effectively or consistently appeal a denied decision within the 12-month period, you can maintain that effective date. So it could, if it takes a VA 5 years and they finally grant the condition, it's pretty exciting stuff.
It's very gratifying when you think about, in that interim time frame between when the claim was filed and when it was approved, having to try to get by,
Oh, yeah.
and scrape by without that payment. Why, it's good that they're made whole.
Absolutely. I mean, some of the VA programs, I mean, they can be really life-changing for a lot of people. For example, there's a benefit called dependency indemnity compensation. So if a veteran dies of a service-connected condition, or if their death is ruled as service-related, that surviving spouse is eligible for a benefit called dependency indemnity compensation, where their monthly benefit payment is the base pay is right around $1,600 a month. They're entitled to the property tax credit program, and they also become eligible for health insurance through CHAMP VA. So, you take an elderly, widow who's, they lose that spouse, they lose that income. If we're able to get them that benefit, I mean, that can mean them staying in their home, not having to, downsize or things or whatever. So it's pretty exciting when these decisions come through.
Pam?
I just had one question. I happened to be talking to a veteran over the weekend, and I don't know how long ago this was. He was just visiting about some of his frustrations. And is it current, or was there a time that he could have been registered somehow as a Wisconsin veteran, but living in the state of Minnesota and therefore not eligible for things? I mean, that was kind of what he was saying, is that somehow he's registered because he did his service when he lived in Wisconsin.
Sure.
But he now lived in Minnesota, and he then lived in Minnesota, and he said he was ruled out of a lot of benefits. Is that something that, is that something in the past tense? Because like I said, I don't know how long ago that was, or is that currently?
That's current as well. So he would be eligible for federal benefits.
Okay.
In order to be eligible for Wisconsin veteran benefits, you do have to be a current Wisconsin resident.
Okay.
So that would be like the Wisconsin GI Bill, the disabled veteran property tax credit. things like that.
Because the state of Wisconsin has their own veteran, but, and he can't change his status as far as that he was a Wisconsin veteran. That's not something that can move since he moved?
So the rules state that their home of record had to have been Wisconsin when they joined the military,
Okay.
or they have to have 5 years of residency. So like in that situation, it sounds like he lived in Wisconsin when he enlisted or joined. Basically, if he came back to Wisconsin that same day he moved back, he would become eligible for those Wisconsin veteran benefits.
Right, but since he lived in Minnesota, and because he had said Minnesota wouldn't recognize him as a, in their veteran situation. It just seemed kind of wrong. So that's why I was just curious if it's something that's still true, what is the way to rectify that? I mean, if that was an active situation, like I said, I think it was quite a few years in the past.
So, yeah, I mean, every state is different. So federal benefits, it doesn't matter where they live or
Sure.
where they live
Okay.
when they join. But every state sets their own guidelines and rules on eligibility.
Got it.
So I don't know what Minnesota's are. I would have to imagine they also have a residency requirement where if he lives in Minnesota for X amount of time, he would then become eligible for the state of Minnesota veteran benefits.
So you think even though at one point he was listed as a Wisconsin veteran, if he lived in Minnesota for 5 years or 10 years, he could then apply for the state of Minnesota veteran benefits?
Correct. Once he
Got it.
meets that
Could have been a
residency.
time frame type thing. Thank you. Thanks for the clarification. Like I said, it was an interesting conversation and, he seemed frustrated, although like I said, I think it was a long time in the past. But I didn't, a veteran's a veteran, but I understand if the different states have different options. So thank you.
Yep, absolutely.
Does anyone else have any questions for Andy today? No?
All right. Thanks.
Look like it, Andy. Thank you.
Enjoy your day.
Okay. And next on our agenda is 2025 budget priorities discussion. Don, did you want to address that? And Tanya?
I think last time I had asked the committee for any priorities that you wanted us to work on. I did let you know that we are trying to stay ahead of our high cost of placements because that's what basically will eat our budget right up. And so we're meeting with some providers now to do some pilot programs. So that is moving forward. We'll continue to update you once we get the contract in place to see if that's working. That's for the Department of Children and Families. And I think behavioral health, those placements would be on the docket too, to model something similar to that. So the whole idea is staying ahead of it so that we can prevent costly placements, Winnebago placements, all of those types of things that are really, really hard on our consumers that we serve, but also hard on our budgets. That continues to be our priority. If anybody has any other priorities that they want us to work on, you can let us know and we can consider that. And then I don't, Don, do you have like local?
Okay, I'll.
Come on down.
Podium.
Yeah.
Thanks for the opportunity to be up here for a few minutes. I'm Don Wortham. I'm the General Government Director, if we haven't met. We'll be seeing each other through the budget season, which pretty much starts right now. And what I'd like to do is just give you a little update of where we are and also address the specifics of the agenda item. I actually think that's a carryover from last year when there was a shared revenue process going through the legislature. And we were really trying to pay attention to how much money the county might get from that process. We ended up getting around $600,000, and that's more or less fixed. It only shifts if our income tax or our taxes move relative to other counties in the state. So if our tax base, sales tax goes down, then that allocation might go down somewhat. We expect it to be relatively stable. On the local side, in budget season, what we're really looking at is our net new construction numbers to see what was built in the last year before and how that's going to impact. The idea is more folks living in our county, more development, more services, so we can increment our revenue, levy revenue by the amount of the net new construction. So that's generally 250 to 300, and we've got a plug number in the budget for about that much this year. So that's on the local side. Sales tax is right now running at about the rate of inflation. It's up 1 month, down another, but the trend seems to be about 3%, which is more or less the inflation rate. So we try to budget sales tax. We generally use last year's figure and roll it forward unless we see any changes. So that's likely what we'll do this year. We'll take the total that we pulled in 2023 and move it into 2025. So in terms of our overall budget process, the community services and public health are right on time with the things that we ask of them in general government. We ask them to prepare a one-page annual report for each of the budget units, and these end up being in the back of your budget book when you get the first iteration of this in September. CSD does its own annual report, which is a little thicker and more comprehensive, but for the purposes of the budget book, it's a real targeted, slender little document. Fee schedules are all in. We've also got information in from our outside agencies, and a couple of those have services that are related to this committee. And we're not really anticipating a lot of changes to funding for any outside agencies this year. You'll hear a little bit more about where things are going at the administrator's condition of the county report, which will be at this upcoming board meeting. So unless you've got questions for me about budget.
Can I just clarify something? He says community services and public health as if they're two separate departments. They're just two separate funds. We act as one division with the three departments within that. So it's a little bit confusing based on how we have our, how we budget and how the funds are set up. So if it seems like public health is a standalone, it's because it has a different fund. And we've been working on that for, I don't know how many years, have we? A lot of years, trying to get it all into
I
one.
used to think I was part of the solution. I guess I'm now part of the problem.
So just if that's confusing, that's fine.
Do we have any other questions for Don?
Don, was our sales tax down somewhat in June?
We were down just dollars. But as I mentioned, we've had some up months and some down months, but you look across the string of them, it looks like we're trending in the 3, maybe even the 4% range. But again, we'll use that previous year number in all likelihood unless we see something dramatic on the horizon. And I can't imagine what that would be right now. So
We had a long climb, but
yeah,
thought I heard that.
we had some years where we were, 6 to 9%, but that was also sort of mirroring inflation.
I seen the figures. I think June was down some.
Mhm. Thank you.
Any other questions for Don? Nope, doesn't appear so. Okay, thank you for that, Don.
Welcome.
We have our, next on our agenda is our state and local budget updates.
We don't have a
It's kind of,
state update yet, but
covered
that's,
that.
the local update.
okay, so
One, yep.
that has been covered. And then we have our public transportation update with Jen.
So we invited Jen Orgerson to come. She's from the ADRC. She's the mobility manager, just hired this year. As a result of that transportation feasibility study that we did a couple of years ago. So we thought she would be the best person to come and give us an update on what's happening.
Yeah, hi, I'm Jen Torgerson, and I am the Mobility and Education Outreach Manager for the ADRC, also serving residents of Polk County, Burnett County. I was hired on March 1st, and what I do specifically is manage and deliver individualized coordinated transportation services on a one-to-one basis with people that are in need of transportation, navigation, and guidance. The services that we provide are for seniors 60 years and older, anyone living with a disability, and also low-income population. Anyone that's basically facing transportation barriers is who we can help in mobility management. The focus is to work with individuals with their transportation needs and match the person that is having the barriers with the right resources. So that's kind of what my scope of work is. We work with local aging units, clinics, senior centers, other service providers to educate and raise awareness of the services that we can provide with mobility management. Also inform people on different transportation options in the community and address the needs and learn what the needs are too. So we're currently offering also a transportation voucher program. This program is in place to reimburse transportation mileage costs for those in need. The two populations that we serve on this are seniors, 60 and older, people with disabilities, and also low income. So this transportation voucher program is a reimbursement for it can be medical appointments, it can be activities of daily living, or like grocery shopping, going to get your hair cut, those types of things, up to 150 miles per month. And these funds were received through a grant, two separate grants. So we're able to provide those services to people in need. And that's a new program that we just kind of rolled out when I started in March. We currently have 12 voucher recipients right now, and we are educating and doing outreach to let people know about those programs. We are currently working on a 5-year transportation plan. And the first goal of this plan was to reestablish a transportation coordination committee that involves different members throughout our community and stakeholders and such to talk about the community needs. So we have reestablished that, and we've had a couple of meetings so far just to talk about what the needs are, how to address them, how to move forward. So we've got that going. That's one of the goals. We're working on this goal to recruit members to join our transportation committee to talk more about moving forward with the needs and working to address those and just do a better job with learning what our needs are. We also have a goal to continue to maintain current transportation services. The ADRC does provide a transportation service to 60 and older people living with disabilities. We have a volunteer driver program that is just booming. We are providing a lot of rides to people in need through that program. And also being able to expand to meet the county needs as possible through outreach and education, just trying to get the word out to what the resources are in regards to what we can provide here and also what's out in the community to also maintain and grow our transportation services. And then to develop, third goal is to develop and improve access to information and increase awareness of transportation services. So this mobility management program that just started in March includes activities to improve customer-focused communication by developing and executing a marketing plan to just talk about what is available and to get the word out. I guess the most important thing that we're doing is just really working on a one-to-one level with people that are in need of transportation to provide the best resources possible and to receive referrals from other departments within the county to be able to help other departments with their clients and transportation too. So our transportation committee will be meeting quarterly to work on that. And we're just moving forward with different things within mobility management. So that's kind of my update. We're required to report quarterly on the mobility management statistics of people that we're assisting and the different goals that we have throughout that reporting process. And also with our transportation program that we provide through our volunteer programs, we also report quarterly on those statistics. And I have those if you're interested in that. But other than that, I don't know if anybody has any questions.
I have a question.
Sure.
So with the new voucher program, you said that you had 12
Yes.
people who were utilizing that.
Mhm.
Is that, those 12 people, is that a combination of Polk and Burnett counties?
Yes.
Both counties?
Yes.
Okay.
It is both. Yep.
Any other questions? Yes.
I just have a comment. Just wanted to say thank you because Jen and I were working with an individual. We're surveying in behavioral health who was challenging and complex. And so we worked it out. Jen really went above and beyond to get this gentleman a ride to an appointment that he desperately needed. So that worked out really well. Thanks, Jen.
Definitely a team effort. For sure. Yeah, for sure.
John?
First of all, congratulations.
Oh,
Thanks for working with Polk County.
Thank you.
I got a couple of questions. So do we have a pool of vehicles, some that are handicapped, lift and that? So
Yes. We do have one bus within Polk County that has a handicap accessible lift. It's a 14-passenger bus. And we use that for social trips. We also use that for medical transportation to appointments for people that have larger wheelchairs. We also have a handicap accessible van, which is, it looks kind of like a caravan that's also able to fit a wheelchair in that vehicle. It just isn't, it's not as accessible for people with large electric wheelchairs that we use the bus for that, but we do have a handicap accessible van that we use for social outings and medical transport.
So
Yes.
we have two vehicles in the pool?
Yes, here. And then in Burnett, we have a bus as well, but we interchange. So like we do use the Burnett bus sometimes for these programs, and so.
Do you coordinate with a person in Burnett County that's doing the same thing you do, or you
No.
doing both?
No, it's two of us actually. So myself and then Cheryl, who is the transportation coordinator, she coordinates for the most part the rides and the social trips and juggles the buses and the vehicles and things like that. That's her position, and she does Polk and Burnett County, and so do I. So we interchange a little bit here and there with our jobs, but yes, there's two of us, so.
You just basically work with medic.
No, we do activities of daily living, rides. We coordinate any kind of a ride that you can
You
imagine.
don't do like work with Meals on Wheels transportation?
No, that's separate from our department, yeah. But we do have Meals on Wheels volunteers, and that's kind of like a separate entity from our transportation volunteers. But yeah,
I haven't been involved in ARDRC for a while. And
yeah,
I used to do the volunteer for Meals on Wheels. And I just live a mile from St. Croix County line.
okay,
And so down on the end of the county, we got some people that they really have some tough needs. Most of them are trying to work out through, there's a lot of volunteers through churches and
sure.
neighborhood things. I know there's more need out there than.
ADRC has a lot of options for services and people to talk to, so.
Thanks for your work.
Madam
Yes,
Chair,
Rita.
question. Thank you. So ADLs, are you referring to like going to the grocery store, going to church? Or?
Yes, those types of things, anything that promotes health and wellness for, an individual, whatever that may mean.
If they meet the age or
Yep.
disability requirements? Okay.
Yep.
Thank you.
I have a question, Jen. So what Rita was just talking about, so if they, to go to church or go to the grocery store, for example, obviously not church, but to go to the grocery store. So they take the person themselves to the store rather than just, taking a list and getting the things and delivering the groceries back to the people.
Correct.
So the people get out of the house then
Correct,
are
yep.
able to do their own shopping independently. and-
Yeah, that's what our volunteer driver program does. It takes, the program is provided to bring people to where they need to go.
Oh,
And the voucher program is if somebody already has a driver,
Okay.
and they have like a caregiver bringing them to an appointment.
Okay.
That is what the reimbursement is for that client to give to the caregiver.
That's so important to help folks maintain their independence, you know, and to be able to do the things themselves that they're able to do themselves. So thank you for all your work in that. Pam?
Just a quick then on the voucher program then. So you just mentioned caregiver, so that could actually be a relative or
Yes.
thing that anybody that was helping support somebody that fit in that
Yes.
category.
Yep. So the voucher recipient is the person in need. They fill out the demographic application and they sign an agreement that they will reimburse their driver that money that they receive. And we do cap it off at 150 miles per month. So
Yeah, thank you.
You have an office here in Balsam Lake?
yes, that's where our transportation office is. Yep.
Rita?
Just one additional question. So the voucher program is something you just started.
Yep, we started it when I started in March. It had been in process for a while before I was hired, but yes.
But that sounds like a real nice addition to mobility for people because, you know, that driver then who's taking them everywhere could have a little incentive. So
Yes.
good.
Yes, and we also look at it as the person that is needing the rides to be able to feel that they can give back to their driver, even if they don't have the funds to do it themselves.
Yeah.
It empowers them to.
Yeah, it does.
Bill?
Jen, could you go into a little bit more detail on your feasibility study over the next 5 years? We've had a couple of presentations in here on public transportation per se, busing, however you want to call it.
Right.
So
Yes, so that is definitely something that is going to be looked at. I know that there are huge needs for public transportation especially for people to get to work and all of the different aspects of getting to where people need to go. As far as a feasibility study, I can't really give you anything on that yet. I'm sorry, I don't have a huge scope of what that looks like yet, but it is definitely, with the transportation committee that we've reestablished, that's definitely something that we're going to be working on. There's a lot of conversation about, you know, how can we expand with what we have? But I don't have a real good something to give you at this point, but we definitely are looking into the future, and as I get going a little bit more and to learn more about what the needs are and where we need to go with that, I should be up and running quick.
wasn't it the director of ADRC that came in and made a presentation
Yeah,
regarding that?
yeah,
Okay.
sorry.
I think that's the big question, Bill, because transportation and housing is, you know, the two biggest needs we have in the county, and it's been standing, growing.
Every 5 years, they're required to do a transportation plan to identify what resources are out there, unmet needs, all of that.
Yep.
The feasibility was something that we specifically carved out through the Regional Planning Commission.
Okay.
And we actually paid for them to administer that survey for us. So we could, because it's always been talked about. So they actually gave us the data that we were looking for to be able to support the
Okay.
mobility manager position and applying for the grants and expanding at that level. So
Yep.
If public transportation is identified as an unmet need, I'm sure they will address.
Yes.
Correct.
Yeah, absolutely. Yep. So this ability management in general came out of just what Tanya was saying. It came out of the feasibility study. And so this position is here to really work with people one-to-one to help them navigate the barriers. That's kind of where we're at, but also to expand services and to try to address needs and future needs too.
Okay.
So.
Well, I know this committee supported that wholeheartedly
Right.
to get
Yes.
you in. We appreciate that.
Yeah, I appreciate you being here. Thanks.
Keep coming in, and it's nice to see that it's rolling.
Yeah.
It is.
So thank you.
And record time, I think, applying for and receiving a grant and getting a program up and
Yeah.
running is, in 2 years is pretty amazing, so.
Yeah.
So let's get that subway built.
Yeah, right.
That's right.
Either underground or elevated, E or however you want to.
Yeah, that would be great. Anything else?
Tony, did you have something for Jen?
No.
Oh, I thought I saw out of the corner of my eye, maybe that you raised your hand. So, okay. Does anybody else have anything? No. Thank you very much for the update and the
Jennifer's
information.
Office is right on the other side of this wall, right down from Phoebe's office, so they have their own transportation office.
Yeah, we have our own office, which is new. It's outside, right outside here. It's supposed to be a one-stop shop for any transportation needs. And we're really trying to create awareness that it's somewhere that people can come to talk with us on a personal basis. And please, refer clients to us. Be happy to meet with them in that office. It's a really nice space. And if you'd like to see it after the meeting, we're just right around the corner here, and there's a sign that says points down the hallway.
Thank you, Jen.
Thank you. Okay, Don, do you have an update for us on housing?
I do. So last year, the board passed a resolution funding a housing partnership with about $200,000. And the idea was to support housing that's in the public interest. So that could be senior housing or workforce housing, any project that increased the base of moderate income, low income, senior housing in the county would be a welcome proposal. So we have received an application from a municipality, and these dollars can only be delivered to a municipality or a tribe, so not a private developer. But we expect the municipalities to work in conjunction with private developers for the most part. A second stipulation is that the project has to maintain or increase the tax base. So that would incentivize essentially for-profit development. We want to keep the tax base, maintain it or improve it. And there's been some concerns on boards and committees about building nonprofit housing because it may not increase the tax base. So this particular program was designed to maintain or increase the tax base. We've received an application from a municipality, and this past week, Councilor Malone, Mo, the administrator, Dan Ruck, and I met and approved that application. And I think the councilor is trying to determine whether we can release the name of the municipality right now. Is that advisable or not?
I was just talking to Claire about a technical issue.
Oh, I was wondering if it was advisable or not advisable to release the name of the municipality at this point.
I think it's public record at this point
Okay.
because they applied.
So it's the city of Amory, and we're very, very happy that they took the time to submit a wonderful application. And it's been approved for 7 townhomes that'll be built, if I'm remembering correctly, south of the high school and on the other side of the river. So 7 townhomes, and the idea is that construction needs to start in a year. The loan, it's so $10,000 for 7 units, $70,000, and the total must be paid back at the point of sale or within 10 years, 0 interest. So with interest rates high, relatively high, I remember when interest rates were 17%, but that was a long time ago. People bought farmland then. That wasn't a good idea. But with interest rates relatively high, it's an excellent situation for a municipality that can cover the cost of some improvements to land and work with the private developer to get some housing built for our county. So we're enthusiastic about that project.
Thank you.
Any questions?
It's exciting.
Very ready. John?
John, now this 200,000, we started a while ago. And is there any process or thought about, I would like to see that at least double. I think we should be working up to at least 400, maybe even. 500,000 at one time. I mean, as long as it's gonna be paid back per approval, I think the county could, you know, it's always the initial.
It's an interesting suggestion, and I think it would be appropriate for this committee to take up that discussion and perhaps bring it before the board. It would require another resolution if I'm not mistaken. The interesting thing about it being a loan program is that basically once the money's lent, it's a receivable. So as long as we've got the money in the bank to kind of keep to the side and lend out as it's necessary, it doesn't really impact the amount of the general fund balance in a way. So that would be something for your committee to discuss and other committees as well.
But just like to see some process, whether it be 50 or numbers aren't important. It just, we should have some process where this could grow rather than just have an initial set aside.
So can you hear me, Fran?
Yes, Supervisor Olson.
So to answer John's question, the county board could choose to put more money in the fund at any time if the fund was depleted.
So
There's still funds available.
$130,000 remaining. So to the degree that you can influence municipalities in your districts to appeal or apply for these funds, or tribes, I think that's perhaps what Supervisor Olson is indicating.
Yeah. Thank you.
Thanks for that comment, Brad, and I'd like to discuss that with you because this is the initial program and it's something that should grow because we got huge needs in the county for.
Yeah, I don't disagree, but it had to be a starting point. And so this gets us off the ground. Realistically, we're still a couple of applications away from running out of money yet.
Thank you, Brad. Do we have any other comments or questions on the program? No?
So Don, there was just been one application?
Well, we actually had two, but one was from a private individual who didn't understand that it was limited to municipalities. So sort of strike that one. We've got one. Now, I've been contacted by another organization that could work with a municipality, but so far haven't seen anything. We have an online form that interested parties can complete, but I haven't seen any activity on that in a while. I believe we're getting, I'm sorry, I didn't mean to, and I should have stayed up longer. I thought we were, my understanding is we were going to be drafting a press release. I don't know if that has been communicated around the horn yet. So to kind of create some more enthusiasm for the program.
Thank you.
Don, I'm the rep for the Polk County Housing Association. And we haven't, I imagine I think the last units that we built was probably in Osceola, at least 30 some years ago. We operate through HUD and there's been nothing in place or researched even since that. So like, could this be a loan like to the Polk County Housing Association too, as long as it's municipal?
Yeah, I apologize for sitting down prematurely. Right now, the way the resolution is drafted, it's for municipalities and tribes. There have been questions about whether it would be appropriate to draft some new language the board would have to approve that might open it up to school districts or other sort of consortia or partnerships. But for right now, the language is just municipalities and tribes. That would be something that your committee and the board could consider, though.
Yeah, I'd like to bring that up at our Polk County Housing meeting and see maybe if, because I think most municipalities, a lot of them at least have, like we have an Osceola Housing Authority and then Polk County Housing, we have buildings, dual and both. And neither one of them have an avenue to expand. And the need is just multiply.
I have a question for you too, Don. If you're done, John?
Yeah.
Okay. So it's my understanding the project in Amory has phases, and ultimately the goal is, I believe, 44, 45 different units. But they've been to the well once here. So as those phases of the project advance, they're not eligible for any additional funding then through the program, or is that spelled?
I think we'd have to read the language of the resolution carefully to,
Yeah.
my understanding is on a per project basis, but I suppose it might depend on how developer and the municipality were defining project, but I defer to Counselor Malone on that.
Okay, and I'm just asking hypothetically, just, as a private citizen.
I mean, it was drafted as a maximum of 70,000 aggregate for one municipality, one project, but I mean, it's up to us and the municipality how we determine what we define as projects. So I think it would be a case by case basis, depending upon what the new request was.
That sounds fair.
I would sure think so, because if Amy, now you got this one early, it should be successful with the need, and maybe they'll want to start another, so I would think it'd be per project, would hope so.
Fran?
Yes, Brad.
So the intent of the resolution was so that at no point could any municipality have more than $70,000 out at a time. So in theory, if Amory was to, pay the $70,000 back and the developer was still developing, I do not see why they would not be eligible for another, up to $70,000 loan. But it is designed so that no municipality could use the whole amount of money that was there.
That sounds fair. Yeah, that sounds fair. Do we have any other questions about that? Thank you. Okay. Moving on. Helen, communicable disease report.
I'm happy to share that our nationwide measles cases are remaining steady. So total in 2024, it's 159 cases across 23 states/jurisdictions. So Wisconsin had one active measles case, and that has been it. So that's very exciting. Locally, it's tick-borne disease illness time. So anaplasmosis, we had 7 cases in June, and Lyme, 27 cases. We're also seeing an uptick in COVID cases, luckily not hospitalizations yet, but more people are testing positive at the clinics and hospitals, and unfortunately nursing homes too, so.
Thank you, Helen. Any questions for her on that? Nope. Okay, then. Moving on, our legislative event report. Jen.
I thought that next week we would be having some steering committee meetings. It was supposed to start right after the 4th or 2nd of July. But I'll be in touch with our Wisconsin counties today. And I'm sure hoping in July that we have some steering committee. We had 5 of them last year in July. And that's why I had a question for Dana, because we got to get some kind of reimbursement for Golden Age. All I know.
Okay, we'll look forward to learning what you find out about that. Item 15, our ad hoc committee report. Tanya.
Yes, so the ad hoc committee is now comprised of the sheriff, the chief deputy, county administrator. They've invited Andrea Jarrick from St. Croix Health to be a hospital representative. Vince Netherland is a community representative. Brad Olson, Supervisor Olson is the chair, or is he the?
He's the chair.
He's the chair. Jay Luke, the county board chair, is also on, and myself. We have sent out The sheriff, myself, and county administrator have sent out inquiries for data to come back to the county. I think there were 33 total counties, so anything basically north of 29 for their emergency detention statistics. Time for clearance from the emergency room to get over to Winnebago, so how long they're sitting in the ERs waiting for medical clearance, and then also transport time. So we've gotten some response back. I know that we are sending out again for a reminder. Our request for deadline was this Friday, and so we're just sending that reminder. I did also learn that Mayo Clinic is expanding 6 to 8 adults mental health crisis beds in the Eau Claire area at their facility in Eau Claire. Those should be completed by the end of this year. So that will definitely help have a more of a local resource. I don't think there's anything for the kids though. So we're still on the hook to get them over to Winnebago or some other option. They are rewriting the urgent care rules to compensate more for some crisis stuff. There's more to come on that. I do believe that the 15 million that was slated for the grants are still being held up in joint finance. It's just sitting there at this point. I don't know if there's any movement on that. And we just want to say that there is more of a benefit to have a private organization. Just because if the county is paying and it's a state run, we pay full cost. If it's done through a private, we can capitalize on all of those private insurances. They'll accept the Medicaid rates and so on. So there could be a price cost benefit to us by having a private entity provide those services. So that's what I know about the ad hoc committee. I think the resolution went out too, and I think there's momentum for the counties to share it with their boards and pass it. And maybe we'll have Supervisor Bonaprise take it up with your work that you do for the steering committees.
I guess I should apologize. I should have asked. Gay and I work together with some things that we bring to the legislature. I bring things from our county association to her. And did you have anything new with it?
I mean, this is something I've been working on for the last 6 years. I've got kind of a timeline. That 15 million is still sitting there. Because it was supposed to go. 6 years ago, it was supposed to go to Eau Claire and Chippewa Falls. And then the governor gave it to Mendota, which was probably needed there too. So then 2 years later, got the 15 million that we were gonna expand the beds in Chippewa Falls and Eau Claire. And it didn't, it just sat there. And
Yeah,
now they closed, so
yeah,
that would have really helped.
it sure would have. Yep. I think they were planning for those expansion of those juvenile and adult beds, but
Yes.
then they pulled out of the regions, so it kind of left us high and dry.
That money's still there, so.
And from our experience with the money that went to Mendota, it's really difficult to get a kid into Mendota. So that money it's not really benefiting us at all.
No, absolutely.
Who pulled that?
Prevea, HSHS.
Oh, I see.
Mhm.
Do you have any session before election?
No, but we can sure draft something up. I mean, if you guys tell me what you want, we can, I'll get hold of Ledge Council and we'll draft whatever bill you want.
I have a question. Tanya, you and I had talked one time about if the counties could apply for that money, that St. Croix County had some interest in that and facilitating that, but that the money wasn't available to a county. The money had to be available to the healthcare organizations. Is that correct?
I believe that's still the
Do
case.
I have the
that it's
correct
not
understanding of that?
Counties are not eligible to apply.
Is there a benefit if that would open up to have counties apply, or maybe that's something that counties aren't interested in? Malia?
Trempealeau County Healthcare has their own facility. And, you know, they've had issues. I don't think it's really feasible for counties to run those inpatient behavioral health units. Having said that, St. Croix County is probably not a site that would help the majority of northern Wisconsin. Because so many folks, just like the Twin Cities for folks from here, are gonna come over to a facility in St. Croix County from Minnesota to receive services. And if they're in Wisconsin, you know, if we have somebody that comes to an ER from Minnesota to, you know, say, St. Croix Health, and they need mental health stabilization and they're in crisis, they're gonna be taken to Winnebago, even though they're from Minnesota. So I think the further in from the border that we site a facility, and by we, I mean, you know, the royal we, is gonna serve Wisconsin, northern counties a little bit more.
Question I have though is staffing, you know, is the further in we get, I think that from my understanding of the situation, the harder it is it's going to be to staff. So if facilities in Eau Claire are closing because of lack of staffing, I don't see how, you know, if we try to locate this in Eau Claire, if there's nobody, you know, if they can't staff and are closing down, you know, what are we gonna do? I know when I attended the DWD, the Workforce Development County Consortium, that was one of the things that was under discussion there was the staffing issue, and then the staff that did lose jobs, of course, you know, assisting them and retraining, relocating, you know, and getting to other places. So I just wanted to make that comment as well. Jay?
The questions that you're raising are the questions that everybody has. And that's one of the reasons that we formed a committee.
Yeah.
Is to understand and to coordinate some of these questions and see if we can get them in one location so we can answer questions like that we have no answer for now, nor does anyone else. And they're all achieving to end up with the same questions, but nobody has ever put them in one location. So you have some answers that are logical, feasible, and available. I mean, some of the funds, of course, are the ultimate goal, but we have no idea what kind of a group. We've reached out to 33 different counties. My heavens, that is not logical for Polk County to figure out a way to put a facility of any kind that's going to take care of anywhere near the needs of 33 different locations. But we need that information. And that's why we have formed the committee. It's now complete. We're trying to coordinate with Brad in efforts to get a meeting put together so that we can start accumulating some of these answers so that we can come out with a logical answer. Nobody has done that. That's the purpose of this originally, is every time we hear the same complaints that Fran's talking about from another location 300 miles away, they got the same problem. But nobody has ever tried to take geographic location that's logical and facilitate, you know, the geographic area with a location that's helpful. Right now, we're traveling miles after mile. I mean, I remember we used to go to Mendota all the time, and that was a chore. I mean, it's just not workable anymore. We're taking a whole deputy out of a workforce just to facilitate, just to take care of the transportation of family needs, and that's not acceptable. So what we're trying to do, and I don't think we're going to ever resolve the problem between Brad and the entire committee. However, we're certainly going to have some answers as to what's feasible, logical, and attainable. And that's all we're working for.
Roger Springer.
Any conversation about it at the present time, I think, is premature.
I think that's why the committee's work is so important. And it's so valuable, you know, that we have put this together, you know, to, you know, try to gather the information to, you know, see what options are available.
I think it's admirable.
Supervisor Olson, did you have any comments?
Yeah, no, I just, I'll say agreeing with Jay. I mean, at this point, there is no thought of where one should be. I would agree with Malia's comment earlier that the closer to the Minnesota border that a facility is, the greater the chances that our counties in Wisconsin lose some of those beds. So, but yeah, I don't think as of yet we're looking at all to say anything about where it should be. It's about finding the need. We know what the need is, but finding out what counties are spending, what they're doing, and then working together with those counties, hopefully in the short future, and seeing what their ideas and thoughts are. And I do know a couple counties that are going to be looking at this. So we may not have an answer from all of them by the end of the week, but their Health and Human Services committees are going to be looking at it at their next meetings. And so I there again, I think we're headed in the right direction, seeing as though we're only 7 or 8 days in from the letters going out. I hopefully a month from now, we will have a lot more information and kind of have a little better direct indication as to the direction we're heading.
Thank you, Brad, for that update. It sounds like you're off to a good start. And, you know, we'll look forward to seeing what happens. Bill.
You know, maybe this has come up with your ad hoc committee, but has anybody looked at if Northwest Passage or Lincoln Hills or any of the other youth facilities in some of the other counties would expand to mental health facilities rather than just the drugs and alcohol? Because I know that Northwest Passage is taking in kids from other states. I know that they've had them as far away. And Lee, maybe you know, I know that there's been 1 or 2 that have come all the way from Colorado.
Oh, yeah, they take kids from around the nation.
So I'm just wondering if they've looked at those private facilities that may expand in another direction.
I know that I can speak for the Department of Children and Families that we have quarterly meetings with the Northwest Passage system to try to collaborate with them on getting more community-based services in order to try to divert some of those hospitalizations. Because I think that if you spend those funds in keeping kids in the community and programs to keep them safely in the community rather than keeping them out to a hospital.
Correct. Okay, but I was just hoping that maybe that has come up with your committee.
Yeah.
That's part of the things that we'll be looking at, of course. There's a numerous amounts of different possibilities, or probabilities, actually.
Yeah, and I don't think I mean, nothing is considered off of the table, certainly at this point yet. I mean, the more options and the broader options that we have moving forward is better for everybody.
Malia, did you have some comments?
I just wanted to say that Northwest Passage, we as a county, Frederick, PD as an agency in our sheriff's department, probably do an ED a month from Northwest Passage to Winnebago for juveniles who are not from Polk County.
Right.
Really?
I do that. I didn't want to say that, Malia, but I do that.
John?
Well, I believe,
Should we speak
that
to
one of
the-
your previous legislators, this is what I got from Wisconsin County, did appropriate the money to buy a facility, and the governor turned it down as far as appropriating money to operate the facility.
Where was the facility?
I believe they were appropriating the money to buy the Baldwin facility before they tore it down.
Oh, some years ago, I think.
Must be before my time.
Yeah.
That's off the table, of course, it's a quick trip there now.
Cape to Start.
Yeah.
Yeah.
Nice one.
Here's your quick trip.
Okay, so the legislature, the last session did appropriate its $2 million for a telemedicine crisis response pilot program. So that would for the police officers. I don't know if we're utilizing that at all, but sometimes that can eliminate having to haul somebody clear to Winnebago and back.
That grant opportunity came out recently,
Yeah.
or one did recently, and we're exploring that with some of our partners. We do know that there was another county in our region that attempted that, and it didn't work out well. For what reasons, we don't know, so we're also asking some questions there.
So we're,
Yeah, what did you learn? What would you do different? So they abandoned it, but we're exploring that right now.
Did you have any comments, Tanya?
Well, so I was going to comment that some counties now, so for example, Trumbull County, if we have an individual placed in Trumbull County, if that individual requires an emergency detention transport up to Winnebago, those counties are now billing back the cost of the law enforcement, the ride. Any type of staff costs are being billed back to the county of origination. And we're seeing that happen more and more now. We don't do that for Polk County yet, but given that Frederick is a location for lots of kids from not from Polk County, I don't know if that would be ever up for consideration. We haven't gone down that road, but other counties are definitely doing that. We have to sign an agreement that says we will pay.
But that's specifically for Trumbull County that owns the facility, so they will not accept our residents unless we sign something saying above and beyond what the statute requires, we're going to basically indemnify Trumbull County for any ancillary costs that result from the placement in their county facility. I don't know. We'd have to look at whether we can, because we also have Amory Behavioral Health. So folks from Minnesota are coming there because it originated as a geriatric inpatient unit with specific targeted clientele, and now it's an all adult facility. So
I would just comment, there was actually a grant opportunity that, RFP that came out yesterday for $9 million for a dementia crisis stabilization unit. And I did reach out to Dana. We're looking at things together. Corby Stark, our manager for our crisis services, is reaching out to Amory to find out if that would be a partnership, because counties have to be the ones to apply. But that's just something else, because we are seeing an increase in those placement needs as well. We'll see.
Okay, do we have any other questions or comments?
Like Jay says, the real crisis that we see here is like the sheriff department now they have to do the transportation. And like they used to be able to do it like in private, but once, there was that, somebody got released down in the rest stop or something. And the last legislative that I was to, I remember Sheriff Knutson, he sat there, and Sacred County has more of a stress level than we do. And he just sat there like that, and the tears run down his face. And he said, I can't run my department and have the stress of doing deputy transportation work. It's huge stress on our sheriff's department.
Okay, well, if we don't have any other questions or comments, then moving on. Our subject matters for our next meeting on August 13th. We refer to our work plan, of course. There's fee schedules, leases, health improvement plan, updating, and then public hearing for 2025 budget. So our meeting will start at 8:30 in August, if anybody wants to go to that. And then our child support mid-year report. I have a question about, I don't know if this would be the appropriate committee or other committees, but something, maybe I would like to see addressed is the shortage of childcare. in Polk County for young families. I don't know if that's an appropriate thing that the county is interested in or not, but I do know that it is a problem countywide for young families. And it's my understanding, especially for infants and toddlers, there's a real housing shortage, or excuse me, childcare shortage. I know with people being able to work remotely at home, there's some people that has been beneficial and has helped with their childcare issues. But I still know it's a huge issue out there. I'm not quite sure where we would even begin or start with it, but I think that it's a countywide issue that would be worth having some discussion about. I don't know what everyone else's thoughts are or what would be an appropriate committee to bring that forth. Tanya, do you have any thoughts on that?
Well, we definitely deal with childcare through, from a benefit standpoint. So Diana could speak to that. However, I think it's more of a development issue as far as developing providers in the area. So I don't know if we work in a partnership with the Economic Development Corporation, and I know Terry is aware of childcare shortage.
Or what do you think, Jay?
Well, it's a huge county. And one thing, the funding for something like that would definitely have to go to the general government. If there's any type of a program that might be applicable or something that we could initiate. I haven't thought of it thoroughly. I mean, I don't have many children left that require health care. I mean, require any care from caregivers, maybe law enforcement, people like that haven't, sure, but the I don't know, it might be something, obviously it'd be through human services.
I do know that we did experience relief in the childcare shortage, even from the time my kids were little until they graduated with the schools opening the daycare centers. I
Yeah.
believe almost every school has.
Of the 8 school districts.
Yeah, Amory
all
has.
Have some sort of
That's huge.
after school
Except for-
program. There's
Except
one
for-
district that doesn't have like infant toddler care. It's before and after, since before and after.
I would put this on a future agenda before we.
Okay, so Bill?
I was gonna say, I would suggest putting that on the agenda and to include how many licensed daycare facilities there are in the county. How many school districts provide before and after care for their clientele. And then how many are providing, much like Unity has, is their LEAP center. And then what are the ages of those kids that are allowed into those centers?
Another thing you might want to consider is the cost.
Yes.
Yeah.
Yes.
Get a handle on the cost, because that's, I think, the major problem with that type of care. How much it costs to take a baby or a child.
I know, Jay, when Unity put their center in, there was a huge discussion with the school board, making sure that they would not be taking away from the licensed daycare centers. They wanted to make sure that the cost was equal to or less than. That was a huge deal when they discussed that before that was
Believe
open.
it.
Yeah.
Well, I guess if we have some consensus to maybe put this on a future agenda and we can bring forth some information, and then from that point, maybe see if it can go anywhere or not go anywhere, or where it may or may not go.
Definitely
Um,
pursuing.
So we'll bring you a report of the current condition of childcare
Yes.
options in the county.
We have an interest from a lot of different entities involved, labor and, those type of people need.
Well, and some, I don't want to be premature here, but something that has come to mind is, and I'm not speaking on their behalf, of course, is the city of Amory has an ad hoc committee for childcare that has been doing a lot of the legwork kind of that we're talking about. I don't know if, there's any interest in any type of collaboration or finding out maybe what they've done. I'm not on that committee. I'm not real knowledgeable about what they've done and they haven't done, but, I do know also, countywide, it is an issue. So that's just another resource that just may be able to share some information.
Put it on the agenda and.
Okay.
address it.
That's what we'll do then. Sounds good. Okay, anything else for subject matter for next time we meet?
If you haven't read the annual report, you'll have the opportunity to bring questions back.
Okay,
Maybe we could get John to put a better music on his phone.
there
I'll work on it.
we go.
Just turn it on.
Well, if we don't have anything
Nothing
else,
else,
then-
make a move to adjourn.
okay.
Second.
Discussion, no, all in favor.
Aye.
Okay,
Tom for me.
thank you, everybody.
How did you do that?